Thank you. Thank you very much, and good afternoon, HIMSS. How's everyone doing? We've survived this far. I hope you're having a wonderful time at HIMSS and enjoying Las Vegas. My name is Chad Dodd. I lead Athena Clinical's product and R&D teams. For those that don't know, athenahealth partners with medical practices across the continuum of care of all sizes to help deliver improved clinical and financial results. We have a robust platform with a rich set of APIs, an incredible set of clinical workflows to help providers be more efficient in what they're doing, a strong rev cycle engine and capability in practice management, and a patient engagement platform that's one of the best in the industry. And I'm partnered with Dr. Janelle Smith, who I'll let her introduce herself.
Hi, my name is Dr. Janelle Smith. I'm an internal medicine primary care provider with Springfield Clinic in Springfield, Illinois. Technically, I work in a different area, but with that organization. So I currently have a full-time practice. I work 4.5 days a week, which is about 1.2 FTE, and also lead a very busy life with 3.5 children. And a husband who also works full time. So I have been leveraging some of their AI solutions in my practice and really making my life more efficient. So I'm here to kind of talk about how that's working for me, things that are going great, things that need to be improved as time goes on.
Great. You know, it's amazing. The EHR has been in the industry for decades. And with the introduction of the HITECH Act in 2009, it was a force of digitization of the healthcare record. You know, what's interesting is, as an industry, we digitized the record, but we did that on the backs of physicians, with the promise that one day we would have this digital record that everyone could see, the longitudinal view of the patient, where we could pass records between practices to make it optimal and easier for physicians. But in reality, we did the opposite. What we did is we asked physicians to populate and fill all the data in, to reconcile charts, to sift through mountains of data and information to be able to understand that patient record. The promise of the digital record, the promise of the digital EHR never really manifested itself or came to life until today. Until 2025, 11 years later, after everyone was mandated to be on the EHR, do we think we have the technology and the solution to truly bring a solution that works for the physician rather than a physician working for the technology. Hopefully over the next 25 minutes, between Dr. Janelle Smith and myself, you're going to come to that same conclusion, that this is the year that healthcare transforms itself, that this is the year we have the technology to truly revolutionize how health is performed. So as we said, I work for athenahealth, and Dr. Janelle Smith works at Springfield Clinic, just as a disclosure. And over the course of the next few minutes, what we want to do is walk through where we are today in that journey, what AI has promised in the past, what it brings forward, and how does that transform actually how the physician works on a day-to-day basis. And that's what Dr. Smith is going to walk through. But as I left that story, we today in the healthcare IT land have provided physicians with a technology that allows them and forces them to put in and document their notes, which has created an administrative burden for them unbeknownst to anyone. They have more pajama time, more documentation time, and actually what has happened is over time, more physicians have left healthcare due to the burden and being burnt out. That's the opportunity. You know, what's interesting is at HIMSS, over the last 10 years, every year someone comes out and says, I have the new AI technology that's going to transform healthcare. And I hate to say that I'm joining on that bandwagon, that this year is the year actually that we're introducing technology that does make that change. When machine learning came out, it was all the rage within HIMSS and across the healthcare industry that with large data sets, models could improve and predict and improve patient care. And then as we get to generative AI, it's not about predictions, it's about creating new content. It's about taking large amounts of information and providing summaries, new information, new conclusions to help streamline patient care, to allow physicians to work the way they want to work, in front of the patients, eye to eye. It's about automating the documentation. It's about bringing insights across disparate sets of data. That's the promise. That's the opportunity that exists with generative AI, with large language models, that hasn't existed before until the last few years. What's fascinating about that is if you ask physicians across the board, some physicians will say, yes, I believe that AI is going to make my life easier. I see the future, but I don't think it's going to reduce my administrative burden. I'm skeptical that it's going to help me today. It's going to make my life easier. And I think what we have as an industry is how can we help bridge that gap, make this easier, better, simpler for our physicians alike so they can practice care, spend more time with their patients. And it's interesting as you walk through the HIMSS floor, as you talk to people, there's an enormous number of models, algorithms, use cases that are being solved through AI. Whether it's drafting responses to patient requests, whether it's document summaries, whether it's identifying patients that are ideal for trials, whether it's being able to connect dots across mountains of documents and summarizing that patient chart based on their history. Those are all great use cases, but that still doesn't remove the administrative burden that the physician has of populating that information, digitizing that record, and putting that in the system. But that's what the Ambient Digital Scribe does. It allows the physician to be a physician, to talk to the patient, to be one-on-one, face-to-face with the physician, while the technology then documents that information, provides the summary, and inserts it directly into the EHR. As simple as that. And at Athena, we've been working to make it as simple as that. As simple as a click. A click that says within the schedule, in that patient's schedule, you can then decide if you want to use an ambient experience. After a consent with a patient, the phone will start to record the conversation, the one-on-one conversation you're having and that physician's having with that patient. Upon completing the conversation, with one click, that entire conversation is summarized and inserted into the proper notes within the patient's chart. As simple as that. And therefore, the physician can then leave, walk, place their orders, have the conversation, continue the dialogue with the patient, but more importantly, has the ability to close their encounters in that same day. The ability to have hours back in their day to spend with family, to spend with friends, to prevent themselves from having to document on the weekends, to give the life back to the physician that they rightfully deserve. That's the transformation that a digital ambient scribe provides. That's the transformation that's before us today. You know, at Athena, one of the things that we think about and what we hold core and near and dear to us and our beliefs and how we design and work through the solution is that we make it simple and easy. As I just illustrated, hopefully you see, one click can make a world of difference, can truly transform that experience. We also believe that it should be in that physician workflow, in that experience. So you don't have to go to another application. You don't have to switch cognitive transition loads. You don't have to cut and paste. That the information, the summary, is brought directly into the chart, as simplistically, transparently as possible. In addition to that, we also believe that we should partner with some of the best AI technology companies in the market to be able to be the backbone, be the engine, be the model that summarizes that chart. And so what we've done behind Athena's UI and user experience is we've partnered with Suki, iScribe, and Suki, iScribe, and Abridge, to be that model, to be that system behind the scenes, to summarize that patient chart, and to bring the system, bring that summary into the Athena EHR. But what that does is it allows the physician to select the system, the model that they want, that they prefer. Give them the option, the tailorability, the selection process, to give them the best solution, the best experience that they want. But that's not the end. This is only the beginning of what AI and ambient can provide. As we continue down this journey, as we create draft notes and bring them in, we can also bring in diagnoses. We can provide draft orders that the physician can then look at, click, and add into the chart. We can start to automate coding with nudges to the physician, to the care team, that says, hey, is this a question you've considered? Document that you've had. We can start to bring real-time clinical decision support at the point of care, in front of the patient, with that physician. This is transformative. This will improve and change the experience that the physician has. It will improve and change the experience that the patient has. Because now they can have that relationship that people have always wanted, that one-on-one dialogue, that one-on-one conversation with their physician. And so with that, it's super exciting to have Dr. Smith talk about her experiences with his ambient experience and how she's gone through that transition.
All right. So I realized that I forgot to mention that I've been able to leverage this because I'm actually on the IT committee of Springfield Clinic. I've been on it for about 1.5 years or so. And I actually joined IT committee because as a geriatric millennial, I'm only average. I'm average at IT things. I'm not horrible. I'm not a complete Luddite, but let's be honest. I am not the one on the IT committee who is writing medical software for fun because we actually have 2 of those. I am the average end user and the average approximately 40-ish person who's doing that. So I thought that some of the more technologically savvy physicians on our IT committee could use being brought down a peg or 2. So that's how I ended up here. So I actually work at Springfield Clinic Morton Primary Care, which is in Morton, Illinois. I do focus on geriatric and preventative care. My very favorite population is that 65 and older. They tend to have the best dirty jokes. I also enjoy gardening, hiking, and spending time with my family. I know that they have added in a really beautiful graphic that is not going to be my actual garden, guys. My garden is usually carrots to try to force my children to eat their vegetables. All right. So ambient listening has been transformative to my practice. So day of documentation. I'm going to be very transparent. I am not the most efficient human when it comes to documentation. There's a couple of reasons behind this. Number one, I'm what they call a rigid perfectionist. That's why I went into internal medicine. This is the things that I love, which also means that my notes are probably more detailed than they need to be, but it helps me remember what I'm doing. So I was closing probably an average of 0 to 10% of my notes same day. I am now closing closer to 90 to 100%, depending on how my day is going and how absolutely chaotic the clinic is, which has been absolutely huge for me. Actually, I think I was supposed to go a little bit forward. Documentation for me was I supposed to go back? Okay, good. Documentation for me is now much different. So previously, I was taking cliff notes during the encounter. So what I was doing is having open my computer, having it in the HPI, and if they were telling me all about their cold, I'd say 3 days. Sore throat, no shortness of breath, all while talking to them, which is wonderful in that at least I would remember some details. However, giant comma, I was paying a lot of attention to my computer screen, which as a patient I abhor, and as a doctor I also don't like. I got into medicine because I like people and I like science, but ultimately, if you're going to be a doctor, you have to love people even when you absolutely do not like them that day. So I enjoy that face-to-face time. It's why I do this instead of bench medicine. And I'm also, again, not spending extra time on my weekends. I was spending an average of 4 to 6 hours on the weekends after spending about 50 hours a week in the clinic. I have a very busy family life. So I have 3 children currently 6 and under, and I'm about to have my 4th. They'll still be 6 and under. I have a husband who is a principal at a high school. So he is working until 10 or 11 p.m., probably 3 to 4 days a week. And y'all, we cannot afford a nanny, like just straight up. It's just us. So we were having to balance all of this. So when they talk about pajama time, they are talking about time after the kids would go to bed, which, let's be honest, would probably fall asleep with them half the time. And so all of that time was coming on my weekends. I have my weekends back since January 6th, which is when I started. I have not gone in the clinic on a single weekend to finish my documentation. And that has been absolutely incredible for my personal life. It has also increased the accuracy of my notes. Because I was only taking cliff notes, 3 days, sore throat, no shortness of breath, some details by the time it did roll around to the weekend, kind of getting lost in the mix. Things like, hey, I had pain on a scale that was about 7 or 8. Well, by the time I get to it, do I remember the number? Probably not. Probably say moderate, high moderate, something of that. So Ambient has been incredibly good at picking up details, things like duration, even like places where I had a patient come back recently from Borneo, and they were like, patient came back from Borneo and had XYZ of this many days, like 2 days after they left the plane. It's been picking up all of those details, which have been incredible. And so I'm getting a lot more hard numbers and getting a lot more details in there than I think I probably would honestly been able to remember at the end. Very importantly, which I've already touched on this, more face time with the patients. I love my patients. They're incredible. They have incredible stories. They have incredible lives. I love hearing about their grandchildren. I love hearing about their day-to-day life. I love hearing about their latest pickleball game and how they actually broke that ankle. But I was spending a lot of time on the computer. Don't get me wrong, I still have to spend some time on the computer because I am still infamous. If I do not put in my orders before I leave that room, I'm going to get distracted and forget what I was going to order, or it'll go in like the next day when they're like, hey, where's my prescription? I still do that. Although it's a lot easier to say, hey guys, just so you know, patient, I'm going to turn to my computer, put in these orders now so I don't forget, than it is to have your head buried the entire time, because I've been able to actively listen to them. And it has also very much improved my billing for encounters. So with the increased accuracy, with closing out same day, and then also capturing things that I wasn't realizing that I was doing by the time it came to write my note. So a really great example, I had a patient come in and ask me about what it would be like to get dental implants because her dentures were driving her absolutely bonkers. Well, I was able to explain that, but then also talk about how her diabetes diagnosis would impact the implants, how osteoporosis and her bisphosphonate would impact all of those things. And those are things that I was going to talk to the patient about anyway, but maybe not capture on a note. So that note went from what was likely going to be a 99213 with talking about edentialism all the way up to a 99214, because now we've covered 3 chronic conditions, and all of that is absolutely valid, but I wasn't necessarily capturing all of the work that I was actually doing. So even though, yes, there's a cost associated with this, 100% I recoup it within at least 2 to 3 patient visits because I am able to bill accurately. So I'm not upbilling, I'm not inflating a bill. I am capturing the work that I was already doing, which I wasn't necessarily capturing before. And I believe that brings us to our Q&A session.
Q&A, yeah.
Oh, thank you.
So Janelle, just to start off the questions a little bit, and just start with the patient experience. Can you talk a little bit about, how have patients received walking in, recording, and even asking them if they don't mind being recorded?
Honestly, it's been better than I thought it would be. I will say, I didn't expect some of the more resistance to come from my generation, but I've actually had a few more in my generation than the older generations kind of take a step back. Illinois is a 2-party consent state, and this does record someone, and so it is appropriate and should be that you ask their permission. I will say 95+% of my patients have been very receptive to it. They're actually kind of excited that they're going to have AI generating a note, so they do get more face-to-face time.
And have you had any patients concerned or raised any alarms or?
I've had a couple patients ask questions. I usually try to answer their questions. If they still are really not into using AI and it's just not their thing, or they have a thought process, it's a little bit more paranoid about where this may end up on the internet or what it might capture, I have just very simply respected their wishes. What am I going to have to do? Write a note like I've been writing notes for the last decade? It's not hard to be respectful of the patients in that way.
You know, it's interesting. One of the concerns that we always hear from physicians is concerns with accuracy and accuracy of the note, and it comes out, and hey, how can it have that description? So, can you just talk a little bit about your experience with accuracy and what comes out from the draft note?
Yeah, so I have found the draft notes to be incredibly accurate. Um, any inaccuracies that I have found in the draft notes have been those of omission rather than commission. So sometimes it might miss if the patient has a long list, because we've all heard of those patients and they come in with something that looks a little bit like a receipt from Costco. Um, so it'll capture most of those, but sometimes it's omitting one or two. So I do still read every single note. I reread all my notes even when I use a solution such as Dragon or my coder transcriptionist, just because sometimes things aren't done right, and somehow Dragon has trouble with my fairly neutral American accent. So
And then not only from the accuracy time, but did it take you a while to change how you interacted with the with your patients and how you spoke in the room to have the recording record appropriately?
it really didn't take me long at all. I'm a very hyper social person. Like, I'm that weird person who starts conversations in the elevator. So with complete strangers. So for me, it was very natural to just start talking to the patient and have that face-to-face interaction. I am still not awesome at verbalizing my physical exam, so I do tend to continue to use templates for that. That being said, it, it's been very good. It's been very good, and it was a very easy transition for me.
You have such an incredible story, and being a member on the IT committee, how do you convince other physicians who might be skeptical to join on, to try and experiment with this new experience?
That has actually not been hard at all. In fact, I have had a lot of the primary care physicians like banging down the door of my operations manager being like, hey, we heard Dr. Smith has this. How do I get it? Like, how am I going to get it? Most of the physicians are excited for this once they found out how well it's working. For, I think there was 6 or 8 of us across different specialties who have it. So I know we have one OBGYN. She's at her own conference this time, so you didn't get to meet her. We have family medicine, internal medicine, rheumatology, and a general surgeon and a colorectal surgeon all using it. We have all enjoyed it. I think that there are some things that it might just be easier to use other chart accelerators that are already built into Athena for, just because, their hypertension is still well controlled forward. But overall, like, people are very excited to be able to leverage this.
And another concern we always get is around training. Can you just talk a little bit about how much training is required, or change management, and just what that experience was like?
I got zero training. I got told on Friday that it would go live Monday morning. And I used it. My clinic, I start at 7:30 in the morning because there is a hard out at 5 o'clock. Like, I have to go pick up the kids from daycare or I will be charged $20 for every 5 minutes. Not happening. So I start my clinic earlier in the morning in order to get my patient-facing hours in, and also provide patients with a easier time when they're working full-time. So there wasn't even anyone in the office to train. When I started using it, it was one button. Did you get consent? Yes. Go. Are you done? Pause. Send. That was how hard it is.
And as you think of like the future and the opportunity and some of the things that are coming forward, what are you most excited about?
I'm really excited for it to potentially attach to coding. One thing I will say, like, I have worked with probably a dozen EMRs between medical school and now, all the way back in the day when it was MS-DOS based at the VA all the way forward. So I think that Athena has been one of the more responsive to feedback, and one of the things that I loved about being in the beta program is that they directly asked for feedback on how would you want this to work if we were able to attach diagnosis codes, and I was able to give them very specific feedback, and God, I cannot wait for that. So that's what I would hope.
Yeah, so just as I mentioned earlier, one of the next things we were doing is adding in automatic diagnoses, adding in orders, and then getting to that coding process where we can start to automate the coding. You can imagine as a new EHR experience where you really have just that handheld experience, and then goes automatically into that coding world. So that's really kind of that transformation, that long-term path that we see, and how this really changes the experience. As you think of those benefits, whether it's your time savings and the accuracy of the notes, and then the coding side, which we just talked about. Do you have other examples of like how you see improved coding, just through the current experience that you have?
Yeah, so the good news is CMS did simplify coding at the beginning of 2024, but I will tell you, nowhere in medical school or residency or even my very first job, where I was a medical director of a hospital and the clinic's not a good first job, first thing out of residency, by the way. That was terrifying, especially because then there was a global pandemic. No one taught us how to code. I've had a coder the entire time. So then I joined Springfield Clinic, and Springfield Clinic is a physician-owned private practice. It is eat what you kill, which is a very rough way of saying, like, I get my profits above and beyond what I produce, which is wonderful in that I have the ability to make more than an average primary care physician. I'm still building my practice. I look forward to that day. It'll be glorious because daycare is crazy expensive. But there are some, even with the simplified CMS codes, there's some things where I'm like, this is like kind of in between, like I'm not quite sure. And having to not pay a third-party coder to do that would be absolutely glorious, or even just having help with those like kind of like charts that are sort of falling in between the criteria.
That's what we really hope we can start to bring to light, is those things that are falling between that criteria and that extra information, that extra nudge that says, hey, did you consider?
Yeah, that
Really,
would be
truly transform.
that would be absolutely glorious. I also love that. I would love it to also maybe like be more nudging. I know that we already have the considered diagnoses that it does put in there, so it's like it is mining. Athena is mining other places and being like, hey, your patient had CHF diagnosis at this ER 2 years ago. It hasn't been addressed. Like, well, that's interesting. Good to know. So probably should be addressed. I would love for that to also be integrated into the AI experience as well, because I have found that to be incredibly helpful too, because patients are wonderful. They are not always good historians.
Yeah, so one of the things we keep looking at is how do we take the references, the information from the chart, that longitudinal record, and continue to bring those insights across the disparate sets of data and bring it forward to you right there at the point of care, so you can have those questions, that dialogue, and bring that right to the patient. Yeah. That's really the future of what we can start to do.
Right. I think that is only going to improve patient care over time. I know that we already have allergies and medications coming in, which has been also very excellent, because I've had patients who've had angioedema and completely forgot that they were ever put on lisinopril. So those things are wonderful, and they make medicine safer.
So I know with that we're just about out of time, and before we close, I just want to say thank you to Dr. Smith, and she truly has an incredible story, and hopefully you see and understand that transformation that we're truly in as a healthcare industry, where we can allow physicians to be physicians, to allow technology to help and assist them, to allow them to spend more time face-to-face with patients and less time in front of the computer. And probably even more importantly, allowing physicians to go home at the end of the day and be with their family and let the work be aside. So when they come back in, it's a fresh day, it's a new day. That's what we have the ability to do now. 2025, that transformation that AI has truly brought. So thanks everyone for joining us. We'll certainly be here for any questions you may have.